taken a really interesting route to being a CEO. I think a lot of people dive into that. A lot of people go like, oh, I just want to build something. I'm a born entrepreneur, and they just go from literally zero to CEO and like founder. And
I actually never intended to be a CEO. I didn't really think about it because I had kind of an outdated view that you probably needed to be a CFO or needed to be something else and like go the traditional route, or, you know, take the frog leap from another C-suite position. I believe in the impact this company could have, and I believe my impact to that business could significantly help. And so I've kind of always been led by that when thinking about impact. I want my son to look back and be like, what Mum did there. She managed to kind of bring this technology to healthcare when it needed it. And that's kind of what drives me internally to kind of keep going.
Hey, everybody. I am delighted this week to be joined by Katie Baker, the director of UK and Ireland for Tandem, which is one of the AI scribes, although I'm sure we're going to learn exactly why it's different. Katie, welcome to Healthtech Podcast. How you doing?
Thank you so much for having me, James. Delighted to be here. Excited to talk about whatever we've got in store today.
Yeah, I know, right? Like I always make this mistake. Like we talk off air a little bit, and then it ends up being like a really good chat. And I'm like, we should be recording. So I'm going to ask you a load of that stuff again and pretend that I've not asked you it before. But first thing I'm going to talk about is your story, because I think very, very relatable for a lot of people. But I will allow you to tell it. And yeah, getting to where you are in health tech, especially from humble beginnings, etc. As mere medics, it's always interesting. So what's your take on it? What's your story?
What's my story? How much do you want to know?
The full version. The full version.
Full version. Well, I guess I came from the Peak District, a tiny village in the middle of nowhere.
Oh, nice.
But always because of family medical issues. So sadly lost a sister at a young age due to heart disease, and had my grandmother had some health problems. Kind of really wanted to go into medicine from a young age. So ended up studying medicine and neuroscience in London at UCL.
Medicine and neuroscience.
So the neuroscience was the bit in the middle that they kind of forced you to do, but I actually really enjoyed it. So you join like the third year neuroscience people and do that degree in the middle. So kind of did that thinking actually that I was doing medicine to try and understand human beings more and try and solve problems with human beings. Turns out that's the wrong degree. I should have been doing psychology at the time, but really enjoyed doing medicine, and trained to be a GP. So kind of, trained in London, ended up being a GP in North Central London, and then very quickly went into think about how we could change health systems. So this is all on fast track, but went into a leadership position in the NHS for urgent care in London, trying to improve how we kind of triage patients and manage patients, and wonderful team of people, but really was like banging my head against a brick wall. Simple triaging pieces would take 10 months to do and a lot of money and multiple kind of groups to get through. So that was the time I very naively thought back in 2017-18, I'll go into health tech and I'll help build products and just bring them into the NHS because that's going to be really easy. Obviously it was not. And I remember my family saying at the time, like, you studied for so long to be a doctor, what on earth are you doing? Like, this is mad. Because at the time, I think it just wasn't a thing to do. Like, even my colleagues and friends were just like, why on earth would you do that? You're a GP, that's what you do. So moved into that area back in 2017-18, started working for a company at that time called Thriver, which is still going. So preventative care, blood testing.
I know Hamish very well.
You know them. Fantastic first experience of a company and understanding business outside of medicine. It just opened my eyes to, my goodness, this is how things work outside of that kind of medical treadmill. And then I'm going to fast forward my story because I don't want to bore people too much, but I kind of worked across 6 different businesses. So ranging from kind of products, operations, strategy, regulations across the UK, EU and the US. And then most recently was CEO, co-founder of a women's health business that I exited from in June. My co-founder is still taking forward in the US. And actually at that time, I'd kind of been involved with 6 different businesses, and thought I'm going to take a little bit of time out to reassess. Do I want to build something else, or do I want to kind of go and work for another company that really fits with what I think needs to be done in healthcare? And so decided to did a charity hike around Mont Blanc, and got the call from
Casual.
Tandem
Just a
investors.
little walk around
Just a little walk.
massive mountain.
You'll understand this about me the more we chat, but I do some kind of very crazy things.
Excellent.
One of them was to go live in mountain huts for 10 days and just
Amazing.
kind of escape technology altogether, because I'd spent so many years trying to build health technology products. And then had to really convince myself why not to join after speaking to the founders of Tandem. And actually, I've spoken to some of the other scribe companies and used some of them at the time. But joined the team back in October. And gosh, it feels like I've been there much, much longer, but brought Tandem to market from Sweden into the UK then, and have rapidly grown since then. So excited to chat a bit more about that. But that's kind of fast forward from, childhood dreams from sheep-filled fields in the Peak District all the way through to now London, kind of building an AI scribe kind of co-pilot business.
Amazing. It's funny, isn't it, how ambition can get the better of you and takes you from these like idyllic environments and for whatever reason drags you back into the big smoke and makes you go and do things. And you're like, why am I doing things when I could just be like not doing as much in these like lovely environments? I remember when I was training in Liverpool to be an anaesthetist, there was sort of got to the end of core training or coming up to the end of core training and just had like what seemed just to me like just a very sort of nice life. It was just very nice. And then as soon as I got comfortable, it was like, oh, but now I want to do all this other stuff. And it was like I'd gone there and like intentionally not doing that other stuff. And then again, the ambition gets the better of you. And then I'm like, oh, all these leadership schemes that I can apply for all this stuff. Yeah. And then you end up back here and one thing leads to another. And I suppose you're taking the longer route to happiness and contentment, I guess. And I think, in your story, I mean, you're definitely someone who wants to build something, aren't you? You've taken a really interesting route to being a CEO. I think a lot of people dive into that. A lot of people go like, oh, I just want to build something. I'm a born entrepreneur. And they just go from literally zero to CEO and like founder, and they're just building something because they just love that chaos. Other people do it a bit more considered, which I think is kind of what you've done. A question I ask a lot is like, how do you build the confidence to become a founder? How do you build the confidence to become a CEO and manage other C's doing things? Like that's a crazy thing to me to just sort of like emerge as confident enough to become a CEO. But you did the rounds. You did the rounds of operations and product and market. Like you've talked about that, like 6 different businesses before you became a CEO. Was that your path? Was that the intention? Did you always want to be the leader, or were you just sort of, what were you chasing? Were you chasing impact? Were you chasing something you were interested in? Like what's the thread that pulls you through that story? What are you chasing? What are you trying to do?
Yeah. And I'll try and be as honest as I can. I'm sure someone will like psychoanalyze what actually the real reason is. But from my point of view, I actually never intended to be a CEO. And I was actually, my kind of co-founder promoted me up to CEO level with the companies that we built. So it was never really a kind of role. In fact, I didn't really think about it because I had kind of an outdated view that you probably needed to be a CFO or needed to be something else and like go the traditional route or, take the frog leap from another C-suite position. So I wasn't really looking at like the hierarchy rise, if that makes sense.
It does.
I was always driven by impact and how quickly we could get to impact. And for me, I think it goes back to the drive you just spoke about. Like my drive is so strong. It's just kind of like, what's the vision and how do we get there? And what's the right way to get there, which led me to these different functions, learning constantly, like pushing myself to grow and understand what you need to be successful in these types of businesses. And then, to be honest, the CEO role, I had such a fantastic team of people. And I think when you're surrounded by people that you trust to be able to manage those functions around you, like, I think there are different types of CEO roles, and mine was really kind of providing vision and support for the team who ultimately made the product what it was. And that's kind of how that move happened. And it was very difficult at the time. When I was offered the role, I spent a good deal of time thinking about it, thinking like how have I even been offered this role? Like, am I capable of being a CEO? Like, this is not, because it's different. I think it's also different, you know, if you're setting up a company and you're CEO without a team. But at that time, it was a team split across like the US, UK, and Europe. And I was just like, I think, you know, I actually spoke to him and was like, I think you might be making a mistake. Like,
Wow.
I don't know whether like I'm the right person. And I was just very honest about it. And he was like, I'm absolutely positive
Wow.
you are the person to do this. And these are the reasons why. And I spoke to my family and they were like, no, you have done this without being called it. And you have actually been doing this for 6 months. So you should do it. And I was like, now's my moment to push myself and surround myself with people that I know can give me the advice I need, because I very much was aware, like, I don't know everything and I certainly am going to need support. And I kind of took the leap and never looked back. I think I learned an incredible amount. I think there's pros and cons of being a CEO. I don't think it's like, I think, you know, when people think about it as a title, it has much more impact than that. It's not worth it for a title, I would say, at all. You have to really, really believe in the company that you're building and really think like you can guide it through. So that's how I got there.
It's interesting, isn't it? Because like the answer to how'd you get the confidence, you sort of didn't get the confidence. Someone actually had the belief in you, which is quite interesting. I find this with some people, you know, we hire people, we employ people, like we manage people, like all of that sort of stuff. And seeing the characters, like some characters are one end of the spectrum with sort of born confident, so much confidence, bordering some misplaced, but like that drives them in a certain way, because they'll put themselves in situations because of that, and then they'll learn, which is amazing. Like that's a form of growth. And on the other side, you've got such diligence and such integrity and such self-reflection that leads them to places and conversations in a different way. But both of those extremes can be restrictive. And I think it's up to the individual, isn't it, to know which side of that scale that you're on. But you at one end, very diligent, huge amounts of integrity, huge amounts of self-reflection, even saying to the person, like, I think you're making a mistake, but them actually like overriding that and going, no, I see something in you here. I think that's wonderful. That's such an amazing place to be, that they're the ones that then instill that in you, to be like, no, actually. And then it comes to another thing. It comes to bravery of like, one of my favorite quotes is that bravery is being scared and doing it anyway. Like that is such like being an entrepreneur and being a CEO and building a company, being a director of an entire country of a big operation like you are now. You're going to have so many of these moments where something's new, something's bigger than the previous thing you've... Like, I say this every day, like every single day I come to work, I've never run a company this big. Every single day, I've never run a company this big, because it's slightly bigger than it was yesterday. Like, it's every day. And so, like, of course there are new challenges, of course there are things, but I've got to be brave. And so...
And I think it's something, I don't know about you, but I am a sucker for it. Like, I absolutely love the challenge of it.
There's a massive to it, 100%.
I just love the challenge. I think I said to the person at the time, like, I probably didn't say you're making the wrong decision, or just like, are you sure
Sure.
Is right? But certainly, I think that's the excitement for me. It's like creating something and knowing that you just don't know what you're going to arrive to any day, and you're just going to have to solve that problem. And it's like problem solving and direction. I thrive off it. I really enjoy it.
That's amazing. Well, you've just got to go forwards, haven't you? And I think that's the thing. So I have recently become a parent. My child is 4 months old. He throws up many extra challenges during the day. I can't be as productive because some of my time I obviously want to spend with him. That's time I would be thinking about ideas or actually replying to emails or Slack messages or whatever it is. Like there's now time in my day that I can't be doing those things. He has incredible bowel movements that require unbelievable amounts of attention at incredibly short notice. Like that throws up additional challenges, especially when you're on something like a podcast or like an important call. It's like, can you look after the child for an hour while I go and do this thing? Like, yeah, sure. I've only got this one meeting. I'm sure it'll be fine. And then obviously it's not fine. And like, there are these things that happen, and obviously like things like they have injections, they get ill, like all. You just have to keep moving forwards. And I think there's an amazing Alex Hormozy quote. He talks about this a lot, where he gets that kind of masochistic joy out of this is where most people will stop. And I think that is another thing that I tend to revert to when I think about growing SomX, which is that when we have these growing pains and things happen and things are difficult, and you can kind of appreciate like they're only difficult because of the size we are, the amount of people, the size of the client, the size of the opportunity, the size of the problem, like all of that is related. And it's like the peak's getting narrower and narrower the more we just push through this. So like in a weird way, I'm sort of enjoying it. So I definitely relate to that.
Yeah, I'm completely aligned with you. And actually I see it in myself, and you talk about self-reflection outside of work as well. So before now I was kind of doing long, ultra running, all that kind of stuff where you really test your like physical and mental boundaries in a different way to like, to be honest, that provided a huge amount of like release outside of work and relaxation. But I do see it across my life of like these challenges that really I kind of find it exciting of like, what can you do, and like what can you experience from those things. So yeah, completely aligned with that.
Well, you're gonna love parenthood, I can tell you.
You're
gonna
that's
love it.
Also been a challenge, right? I didn't expect to be, I'm 33 weeks pregnant now, but when I launched the market, it was planned, but definitely thought I would be falling pregnant in a few years because I'm a bit older now, and absolutely delighted. But that certainly was a challenge of, okay, I'm going to grow a market now whilst being pregnant. So it's been a
market and a human. Yeah, I mean that's no mean feat. That's no mean feat. I think watching Jess do it has been actually just one of the joys of my life. Actually, watching how she's done it. To grow a human and to now be looking after one and super mumming, taking him to events, and just seems to take it all in a stride. It's incredible to see. Like, and she's obviously co-founder, and
it's amazing.
We find a way to make it work and work together and all that sort of stuff. But as I say, that kind of masochistic, these are challenges, we will push through them. This is where people fail. You're gonna have a lot of that.
Exactly. Yeah, it kind of drives you. Do you know what? Some of the challenges that you mentioned, and I certainly wouldn't put this as a challenge because I'm so overjoyed, but it's some of them just push you even harder because you think, okay, well, I want my son to look back and be like, my mum did that well, kind of, growing me. She managed to kind of bring this technology to healthcare when it needed it, and that's kind of what drives me internally to kind of keep going through times that sometimes you're more tired than usual, etc., etc. But it's been such a wonderful time.
We did a Google event the other week with Harvinder from Motix, another one of the scribes, and Keith Grimes, Laura Tan from Avid, and because of like childcare stuff, etc. Like my son was in the room, and it was really interesting because I remember thinking, like, I'm on stage at Google, I'm talking about health tech stuff, and it's so easy to just in my normal life sort of gloss over that and be like, oh, it's just another Google event or whatever. Like, super exciting we started doing them, but then that like you can fall prey to like, oh, this is just another event, it's another thing, but I'm now seeing what I have achieved in health tech actually through beginner's eyes again. Because I was thinking when he was in the room, I was thinking like, man, like he's gonna, like that's like a thing for him to be like, he's a nepo baby. Like he's a nepo baby. He's like, his dad's on stage at Google. I'm like, wow, that's like really cool. Like, is it? Like, is that cool or is that really nerdy? I don't know. Like, is that? But the
You
point,
should get
but
him a little baby grow with
oh, I should have. Oh, they
just
probably
a
do
picture
them,
of your
don't they?
face on
They
it.
probably do. Oh God. But it's interesting. Like, I don't know. It's definitely helped me appreciate what I'm doing in health tech more. Like, genuinely, you talked
Mm,
about impact, and I think one thing I actually wrote down with impact is that a lot of people say chasing impact, and they can mean different things. Like,
right.
when I hear chasing impact from someone like you, I think there's something baked in there of like you're I think what you're actually talking about, as well as obviously the impact that you're making, I think
Mm,
astute people know where opportunity is. I think
mhm,
astute people know that impact and opportunity are kind of linked in
mhm,
the sense that where there are lots of problems to be solved that
mhm,
can be solved,
mhm.
i.e., healthcare needing technology, there's
Yeah.
obviously going to be a lot of transactions that occur as this space gets better.
Yeah.
With a lot of transactions, there's a lot of places that you can insert yourself and create a business. And
Mhm,
so I think actually, when I think about impact, and when I had this reflection the other day when I was like in the middle of a talk, that
mm,
actually I think that's what I saw. I don't know if that's what you're talking about as well, but
mm.
making the bet on health tech like 15 years ago, whatever it was, when I first started doing like health IT or whatever it was called then, it was kind of like, surely there's loads that can happen here. Like,
Yeah.
surely. And I think I can make impact. And I think that's what I was talking about. But you've
Yeah.
obviously gone to, you 6 different businesses, started your own,
Mhm.
now doing Tandem. Like, what's your relationship with impact in health tech, and how do you sort of see the sector as it's grown or growing in the time that you've been in it?
Mine goes back. I can kind of pinpoint the moment. It's a very weird moment when it goes back to neuroscience actually, and I was in a lecture about neural networks, and this is so geeky, but just bear with me.
I am.
And it made me think about pattern recognition and technology
Mm,
in healthcare, and how just the way that things were being taught and done now were not going to be sustainable for the future. If you think about like the growing population,
mm,
chronic disease, all of these things. And I very much knew at the time, like I wanted to be the best clinician I could be. I wanted to be the clinician that if I walked into a GP surgery, that's the person that I would want sat to be able to listen to me. And that's where I started, but then thought, well, I can't solve this just being sat in this room. I need to mix this being on the ground with creating the technology or the networks or the patterns that are going to streamline healthcare and really impact people. And the where I saw that probably happening most was in firstly in operations in the NHS, so administration, but also in connecting data, like using data to improve health care across different systems. And so my impact was always to improve healthcare globally, which is such a broad statement, but made it up at like 18 or whatever it was.
mm,
And it's always been aligned to how do you do that? Because if you look at any health system in the world, any one of it can be improved. And where do you want to focus your time? And I think linking into what you were saying about impact, it's where do you think, well, for me, it's always about how do I think I can create the most value at what time, and that changes over time as you gain more experience. So I was kind of led by, I think I can add huge value. The first company I worked in, Thriver, of improving preventative healthcare in the UK, and that's where I really deeply believe in the mission. I believe in the impact this company could have, and I believe my impact to that business could significantly help. And so I've kind of always been led by that when thinking about impact, if that makes sense.
mm.
Um,
It does.
with more being aligned to missions than companies, of just wanting to improve healthcare for people whilst I'm on this planet. So yeah. 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 Mhm. Yeah. 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 So, Brilliant. Mhm. Yeah. 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 That's a really interesting question. I think there's this span from wellness all the way through to healthcare. I obviously still think our health system is very reactive, as you're saying. Um, but I think for me, there's two things to think about. One is um, that healthcare is becoming more consumer driven and kind of consumer led, and people are collecting their own data and thinking about what they need for their healthcare now. And so I think we will see that shift um, from a prevention approach, but I still think it'll be driven probably by consumer for a while until we get that right. Um, the second part, though, that really excites me is data. Again, I'm going to sound totally geeky here, but if we think about structured data in healthcare, we don't have much of it at the moment. And that's what excites me so much about Scribe's
I
capabilities
was going to say the
of
word structured there is so important.
it's like transforming that into usable data that can then be looked at on a population level to prevent from within a healthcare setting to reduce negative outcomes, whether they be financial or clinical, for the health system to optimize how well the health system is doing and supporting the population. So I think they're running in parallel. So there's like the wellness prevention piece, which is very much driven by people who can afford it, who are looking at data and doing their own biohacking that you spoke about, whilst the health system gears up, which will take a while, but to create this more structured data set to be able to actually help the population that need it, who are most often the people who can't afford it. So I see them running in parallel, basically.
It's really interesting. The when I talk about the use of data and population level and stuff like that, like
Yep.
I just set up this next gen community, right? So
Yeah.
like set up a community, set up a committee that runs the community now, and basically just sort of watching it in their
Listen.
committee WhatsApp group, like just smashing it. They got their first event on Thursday. They did
Yeah.
it's really interesting. This was one of the joys. This is one of the reasons I set it up, to just see how young people are actually using stuff, doing stuff, thinking about
Brilliant.
stuff, so that I can actually start having a view on the future and let that inform what we do, and actually to surface a lot of those views into the health tech world, so that we can stop the
Yeah.
same people on the stage, me included, saying the same old stuff, and like actually get some new views on stuff. Anyway, for their event on
Yeah.
Thursday, they did this, like, set up the Eventbrite, and they did this like questionnaire, and I was like, oh, no one's going to answer a questionnaire. Like, just thinking in my mind, like, that's one thing, they're not going to do that. Everyone obviously answered the questionnaire, so I was like, right, I was wrong on that. Second, and I didn't say any of this, by the way, I just sort of watched it and learned, because this is part of the joy. Not only did everyone answer the questionnaire, they then just ran it through large language models and just asking, like, oh, how should, based on this, people are writing, like, I don't know, what should we, like, what are you working on, was one of the questions. Like, what do you want to see at the event? Like, what is a good event to you? Like, all of this sort of like really qualitative data that I wouldn't even think to collect, because it'd just be a nightmare. They just run it through a large language model, and they're like, right, how should we run our event? And it's like, oh, you should run your event like this. Like, you should do this, because this will, and these are the splits of people. This is broadly what, that, you know, there's 13% of people working on women's health. And then they've set up like hot corners where they're going to like put like seed conversations in different corners of the room based on like the things that people are most. And I was like,
That's
my God, it can structure the data for you. This is,
yeah.
you don't even need to like like fire code any of this stuff anymore, like any of that stuff. This is like the amount of things that are possible. And it's
Yeah.
just stuff that I would have never even considered. And it's just been such a joyous experience, like watching this on this like incredibly small scale. But to your point, you know, sat in that lecture, watching, you know, or listening to neural networks and going like, hold on a minute, hold on a minute. I think things are fundamentally going to change here. Which I guess leads us perfectly onto scribes, right? So tell me about Tandem.
Yeah.
Tell me about, what you guys are up to, why it might be different to the other lot that I'm going to bring on and say that they're different to, etc.
Of course.
So, like, tell me about the scribes, and then we
Years.
can talk about some of the crazy opinions on scribes and see what you
Yeah,
think of
let's
them.
do it. Tandem. So, as I mentioned, I was first introduced to them back in October, actually by their investors. And do you know what? It was really upon meeting the founders, which I met very quickly, that I knew this company would be different. And there's a couple of reasons for that. One is that the founding team have spent most of their life in healthcare. So one is kind of senior partner for McKinsey for Europe for healthcare. So it was actually seeing these scribes being built and thought, actually, we need to build this in a way that's scalable and works with health systems and is built, could see kind of, you know, lots of these scribes will die out. How do you build a product that actually works in this system? Paired with our CEO, Lucas, who's kind of built healthcare analytics at Quantum Black. I think a lot of scribes' value is around coding, structured data, like improving quality and outputs. And then they're paired with a very talented CTO who's worked in AI and, you know, Google's, Uber's in the US and come to the UK. Is based out of Stockholm, but started obviously helping them build this. But it's the next step that interested me most, because they then brought in clinicians. So they built like an MDT approach to how to produce the best clinical notes that were actually needed for adoption to be driven. Because it's like building the product, but then it's like, well, if not, you know, lots of people build products and maybe it's even solving a problem, which is great. But if people aren't going to use it, or like it doesn't fit into their workflows, it's kind of pointless. So kind of I think it's over 70% now, it may still be over 80% of the team are clinical by background from different, it's almost like an MDT approach. So physios, psychologists, you know, surgeons, secondary care, primary care, to help build the product, all with a background in either health tech, business, or prompting and tech. And then they built out from there and have taken such a strong approach to that clinical piece plus safety. So when we came to the UK, what that meant was that we could very quickly differentiate ourselves in certain sectors. But beyond that, because of the way it's been built, the interoperability, they already had over 25 EMR integrations, which for speed, I mean, if you think about this company being 18 months old, like I thought that was like very, very kind of strong.
25 EMR integrations.
So then so once we started to set up in the UK and we focused, talk a bit more about the journey there, but my aim within the first 90 days was to set us up from a regulatory, make sure from a legal perspective everything was fine in the UK, but also go into look at the private and the public market and really look at the sectors where we go. And there's obviously a huge issue in primary care at the moment in the UK. So build that into current GPs' workflows, and that's where the scale suddenly starts to come. Because I mean, I think there's space in the market for multiple scribes, but I think really integrating with EMRs, providing structured clinical coding, which feeds into different stakeholders, right? You've got the people using the technology, which are often partners of practices who also need to be paid for coding, etc. And then you're thinking about longer term financial impacts of medical legal implications, etc. So I guess there's three main areas of differentiation: the usability, and then the actual kind of interoperability of Tandem, plus the customization you can do per specialty, which sets us apart from others.
The integrations thing, I think, is really interesting. So
Yeah.
I think, you know, as you're talking there, you're talking about clinical coding and everything that then it's integrated with to form a better experience end to end, it creates more value than just to the doctors, right? Or the clinician.
Yes.
That's,
Yeah.
there's obviously physiotherapists and everyone else.
Yeah.
So I think this is the interesting thing, is that when they're in the private sector, it seems quite straightforward. We talked about this at the Google event, actually, that it's much more straightforward in the private sector because time is money, and you can save time. That means you can get more throughput of patients, therefore you can save money.
Yeah.
It's quite, or you can remove staff, make a direct P&L cost saving, etc., etc. So like a lot of it seems a lot more straightforward in that private model. And what I mean by that is like a single clinic model, I guess, where it's not a big health system. It's a single private clinic, so the individual clinic owners can make that decision. You can realize the value. One thing we talked about was that in big health systems and in public sector big systems particularly, value is not as easily recognized. Because whilst you could deploy everywhere in the NHS and you could speed people up in inverted commas, the question then comes to do what? Is it that you're going to start sacking staff? Is it that you're going to reduce your staff numbers in some way? Well, you're not really going to do that. That's politically very dangerous to do because health is politicized. So what are you actually doing? Are you going to reorganize care? Are you going to put different staff in front of, like, if you're going to do that, then that's going to require a huge consultation in order to decide what's your vision for what healthcare should actually look like. So to deploy into a big system is quite difficult because it's a cost. And so where is that cost being saved elsewhere, realized, etc., etc.? So what are your thoughts on that? How do you see the world there?
This is quite interesting, and some I'll be able to say and some I'll not be able to say because there's going to be an announcement from when we're recording to next Tuesday of a big partnership for the NHS, which will make this more clear.
Right.
But I think scribes alone can produce certain value. I think it's actually very dangerous to look at scribes as like giving, even in the private sector less so, as you say, but allowing people to see more patients.
Yeah.
If someone said that to me as a GP, I'd just be like, I'm broken already. Like, this isn't happening.
Yeah.
So it's thinking about how do you, like we spoke about, how do you fit into current systems and transform that whole pathway without it feeling to a clinician like they need to learn a whole new tool, totally change the way that they're working, because the mental capacity to do that this time in the NHS is just not there. So how can we think about from, digital triage all the way through to the consultation, coding, outcomes and communication, optimizing care pathways across the whole system, where you can see beyond just a scribe and adding more patients, you can see improved financial and clinical outcomes at scale, which suddenly makes the solution, what you're paying for. If you're the CFO, the ROI is significant. But if you're the clinician or the patient, you've got multiple measures, which is what we're studying as well. So improved patient outcomes, improved experience, and thinking about workplace kind of retention as well. Like, we know people are struggling at the moment. So I think it goes beyond, thinking about adding more work onto an already full plate. It's how can we make the system better for such talented staff to work in.
Yes.
And that's been there for so long that I think that's where we can have a massive impact.
That's where it gets interesting for me. And I actually almost want to take the time argument out because exactly like you just said, for the exact reason you've just said, is that the value can be realized in so many different places when we've automated clinical coding even. Just, that bit's huge. Absolutely huge. Especially in a payer model in the US and all that sort of stuff, and insurer models and stuff. Like, it's incredible to me that when you start digging into this, similar to, the next gen community figuring out, this can code itself, and actually now you can get all these insights. With these insights, we're going to make a better event. With a better event, we're going to have a stronger community. With a stronger community, we can get more people. With more people, we can get more stuff. Like, these are the benefits that can be realized downstream of let's put a questionnaire in the newsletter and apply an LLM to it, which is sort of like where scribes are being thought about now, like that very
Yeah.
sort of initial surface level, oh, it writes my notes for me.
Yeah. Yeah.
There's other people here that are going to feel value once they're integrated as part of a system. And I think that's the way that they probably need to be thought about, if I'm understanding what you're saying correctly.
And then it's distributing across an area large enough that you see
the insights.
You see the insights not in like fragmented systems, which is what we have. You see it across primary, community, mental health, acutes. You see it across the systems. And that's what really, really excites me. And I think that's like the first, I genuinely feel like this will look back on this period of time and it will be incredible to think we were there, because I think this is the first change of like fitting into the current system, and then we can start to really transform how healthcare happens, going back to the preventative and then reactive piece. But you need the foundations to be able to do that operationally first.
I agree. I think this is going to be, I actually said this for a couple of years, that I think we're approaching a time, I think we're in it now. We were approaching it 2 years ago. I think we're in it now, that we will talk about pre and post this time. What we'll call it, I don't know. Probably the AI boom or something. But we will talk about a time pre and post, because I do honestly think it will be that transformational in terms of the way that we practice. One thing, though, that never ceases to amaze me is doctors' ability. And I say doctors because I am one. So I feel like it's a community that I can... let's say banter or neg slightly, given that I've been one. But one thing that never ceases to amaze me is doctors' ability to kind of shoot themselves in the foot in the face of what could be something potentially amazing. The voice appears of, oh, here's all the reasons why we shouldn't do this. And it's like, whether there's like a contrarian nature, or whether or not doctors are just trained to find problems in things, so they just find this perverse joy in finding problems in things when they're going to be so amazing. And we'll talk about some of the things like hallucination and all, some of the reasons that we might not want scribe. I will address those. The first thing I want to address, though, is the rising movement of people getting a load of LinkedIn likes for saying, no, but we do our learning through writing notes. And so what's happening to all this learning? I don't want to do this learning anymore. And we should, like, learning is where thinking happens, and learning, like, writing is where thinking and learning happens. Writing is this, writing is that, writing is that. Like, evangelizing writing all of a sudden, when for like the last 15 years, it's been, oh, we do too much admin, we write too many notes. And so, like, it's now all of a sudden, it's like the contrarian thing to say. It's like the cool thing to say, to be like, yeah, but writing is where all the learning happens, and we're not going to be doing that anymore. And it's like, come on, can you not just like watch a video or like write something in your own time? Like, if that's how you learn, can we not mitigate for this tiny little thing that you're talking about here? And like, maybe like, as we're training through GP or whatever, like you start off writing notes and you gradually pull that back as you, like, I don't know, whatever, like whether it's like grade related or whether it's something like there are many ways that we can pick to solve the problem. But like, let's not throw the baby out of the bathwater here. Let's not cut our nose off to spite our face. Let's how about let's do the thing that reduces our admin by 99% and then mitigate for the 1%. Like, and someone can correct me on those numbers in my DMs, and I'm sure they will. It might not be 99 and 1. However, I feel quite passionately that when a transformational technology comes in, that frankly you are not going to hold back the tide on. Like, the conversation should turn to mitigating for the problems, not throwing out the potential solution. I'm definitely preaching to the choir here, but as a clinician, what are your thoughts?
Do you know what? I think my thoughts are less strong than yours. Surprisingly, bearing in mind I work for an AI company.
I've said it for you, so you can be more tempered.
So I think there's a couple of things. One is that clinicians, I think, and this became really apparent when moving from pure clinical care into health tech, is that clinicians are overall quite risk averse. And I might be shut down for saying this.
No, I think that's fair.
And I think it's the way that we're trained. You think about what the negative outcomes would be. And so I think that's a very positive thing when you're dealing with someone's health. I think it's really important. And so I think when people are addressed with these technologies that frankly a lot of the population don't understand, it's more fear. And it's like, how can you trust these things and what are the negative impacts? And actually, I think it's obviously there's a behavioral component of learning through writing and processing, but I think it goes beyond that to like, how do we educate clinicians of what these things do and how they should be used to not as negatively impact, your analysis and your thinking time. I read a really interesting book called Genesis by Kissinger, which is about AI and how it's transforming different sectors, which I'd recommend to anyone who's interested in AI. And it actually talks about this topic.
Oh, wow.
And thinks about, how we did used to use our minds in a different way. And there may be impacts that we need to think about of, okay, well, if, at the moment, even in businesses, you'll go in and be like, what's the answer to this? And someone will look on Perplexity or ChatGPT or whatever and be like, this is the answer. And they will blindly follow the answer, which I don't actually think is the right thing to do. I think it's something in between of how do you provide a system where you can be supported, but you still like actually look at that and use your own functions. And this might be really bold to say, but I think about, if you walk into the British Museum and you look at some of the sculptures, like if we stop using certain functions for a long time, so if we stop critical thinking or whatever, I think there is a risk that we will lose that. I don't think this can be applied to scribes. I'm talking about like much bigger in terms of AI. And so I think we should, as a society, in some work that I'm looking at with a kind of global AI group of like, how do you prevent the kind of negative outcomes that we could see? But I agree with you on that they should be the mitigations. And actually, when we think about scribes, it's how is the product built in a way that thinks about these things, thinks of them as hazards, and then mitigates for them. And so I'm on the same page as you with that these technologies are kind of transformational for admin. And as long as they're built in a thoughtful way that are mitigating for these concerns, I think clinicians should be open to them, but it's also on the companies building them to educate and work with those clinicians to understand their fears, to understand their concerns, and to provide information that allows them to kind of get over those beliefs. And there's different ways that can be done. And it's certainly something we've looked at in like a large primary care study we're doing, for example. But interesting, I kind of see it from both sides. And I think it's about how do you build products that work and don't negatively impact. So there's several things we do in our product that mean you have to critically think to be able to see the note, etc. So I could debate this for a while.
Yeah, I think
that's my unbiased.
No, that was good. That was nice. But I think my rant probably comes from, I think I tried to innovate within clinical medicine for far too long, that I think I just got a bit jaded of just being told no, because that's always the way it's been by people more senior than me that just had
this annoys me.
Like,
don't get me started. This bit annoys me when there's actually no rational, like when it's just because I think there's a multitude of problems. One is like trust, but the second thing is like, if we think about it, clinicians are just jaded, right?
Yeah.
Like they don't have they don't have the time or space to even consider. And I think that's what we see with lots of technology is that like to adopt it, you have to learn a new system and you have to have it implemented properly, etc. And to be honest, most people are just trying to get through the day. And so for me, it's about how do you enable those people to like understand the technology and use it so they can see the benefit. And that's the bit we need to crack.
I think that's very reasonable thing to say, because I actually think you're right. Being open-minded to something actually requires energy, because you've got to receive that information, you've got to process that information, and you've got to offer some reasonable critique or feedback, or you've got to try and put that into your own understanding and give something useful back, like that. Like the ability to be open-minded to even consider how something might even come in is what suffers when you oppress a workforce so much that they just have literally no time. I think though that's where my frustration comes from, when you've got such a transformative technology potentially for all its potential faults, but clearly been used to lots of good in lots of places. But I get frustrated when I'm like, come on, like, please don't throw this like learning argument up as like a real significant barrier. Like, how about we give you loads of space to be open-minded through time by doing this, and then like we can start to figure those problems out, and like we can get on this like positive like cycle rather than the negative cycle where there's no time and things are rejected, and then we don't bring anything new, and then it's more difficult to innovate, and it's more difficult to pilot things into, and you're looking for those champions and those champions only. And we could turn this around. Something's got to turn this around. I've not seen anything as exciting as this. But obviously there are things that people talk about a lot. So the one that gets brought up a lot in sort of like, you know, the people that are in the regulatory community and things like that is that hallucinations can occur. Hallucinations can multiply when you've got hallucinations in notes. You've got a second consultation that relies on this previous notes, takes into account the hallucination. Then you've got hallucination squared, cubed to the power of 100, and at some point, theoretically, you've got notes that are zero truth from 100% truth because it's degraded over time, almost like an analog signal will degrade over time. It's sort of like that's an argument. So obviously there's the human in the loop component. The human can check it. That requires training, that requires retraining, it requires a new system. But again, for me, it's like a mitigating thing. But like, how do you guys deal with that argument when you might have that in a sales context, or when you're just trying to convince someone in your personal context because you know it's a good idea? Like, what do you say in response to that?
I guess there's different things to think about. So one is, you know, when you think about, we're talking specifically about healthcare, which needs to be thought about differently than other AI products, I think, in a more safe way. And if you think about the normal human error hallucination rate and what the current technology does, even the hallucination rates in like the base models that people are using are lower than an adult, like me typing into my GP note at the end of the day, something wrong that's then looked at by another GP. I think the rate's something like 11% for human beings. So 11 in 100 will have like a significant error in the notes from typing. And that's probably worse with like more burnout, more exhaustion. If you think about the technology, obviously there is risk of hallucination. So there's different things. There's like the mitigators within the technology itself. And then, as you said, there's the human in the loop. So there was a big news piece about Whisper previously about basically if it doesn't hear something, it just kind of fills in the gaps, almost like our brains do when we're reading something. We don't look at all the letters, it just fills in a word. Similar thing because it's based on transcription. And so we've put mitigations in our products that if something is not explicitly heard, it's not put in. Because the biggest, if we talk about scribe specifically, the biggest risk of hallucination is from that first audio to transcription. So we've spent a lot of time on optimizing audio to transcription with microphones, with prompting, with like specific modeling, which allows to ensure the accuracy rate is as high as we can. And then we know, there's still risks. So you put clinical safety mechanisms around with your clinical safety officers, etc., to try and mitigate the risk. And then obviously, like you say, it is a fallback, but really then you've still got human in the loop before you even transfer to the notes. And so my argument would be, absolutely, we should take hallucinations seriously. Absolutely, they could have impact. But with anything, if you're actually auditing it and having surveillance on it, I would argue that that's better than like clinicians just like typing in notes and saving them, and that then going off with a much higher error rate.
It's quite funny as you're talking then, it sort of hit me that this also doesn't need to be one or the other. Coming back to something that we talked about earlier, the value is being realized beyond just the clinician not writing notes. The clinician not writing notes is actually, in the grand scheme of things, if we zoom out and then go on a big timeline, that's actually not the biggest thing that we're solving for here. We're solving for population level structured data across entire health systems. That's the goal here. So actually, it sort of strikes me that if we're talking about a public healthcare system with all these things that people are worried about, it's kind of like, hold on a minute, put them in. I get that there's a cost. Put them in. We can start to knock out some low-hanging fruit in terms of realization of P&L savings. But actually, we're really focused on this stuff down the line. If you still want to write notes, go ahead. go ahead and actually write your notes. And actually, it might be that the notes fall down to a level that becomes appropriate for the clinician. Like maybe they just end up writing, the red flags, or maybe they write the things that are super important to them with how they're going to communicate, or something that maybe even adds value to the consultation that wouldn't have been able to be documented previously, because now they've got the chance to write that bit. So actually, it's almost like a two-way relationship between like, okay, currently we're writing notes 100%, currently we're 0% scribes. Some places are 50% notes, 50% scribes because they're doing 100% of both. But actually, maybe it falls to a level where you've got the scribe going, but actually those 10% of notes are now pure value adds. You've got 110% of value rather than like, and so there's something there for me that you talked about studies actually, that, you mentioned that this is something that we're studying. This interplay between how humans are reacting to this technology feels like definitely something that should be studied. Like, how does the consultation change the other way? Not just through our own will, but actually through like, how do we actually just behave in the presence of this new technology? Is that something that is being studied to your knowledge?
Yeah. So I can talk about things that we're looking at specifically or have looked at already. So there's different components, but from the clinician's perspective, how is that changing their consultation, like you said? And so how it's decreasing screen time, how it's like changing their interaction with the patient, how it's changing their processing.
Because people talk about eye contact, don't they? They're like, oh, I've got loads more eye contact.
So the biggest thing that's come back is mental burden. So like having to remember, like, often you're running back-to-back clinics and people aren't able to type their notes. So trying to remember all of those things is really difficult. So there's that piece. From the patient side, obviously talk to patient participation groups and are thinking about how they see any difference in their interaction with clinicians. But not only that, now there's the NHS app, like how they view their notes. So one thing we do in Tandem is we can create patient-facing, like late-term summaries. So that the aim is so that people can more readily understand their health plan, be more engaged to then drive, which we need obviously more data on, but we're moving towards that's the communication and how we're optimizing that side of things. But yes, there's a lot of things we're currently studying or have studied based on those two things. And then there's obviously the additional like quality and auditing of notes, structured data. One thing on structured data, I did a roundtable a few months ago, and it was on the Q risk. I'm going to probably be killed for saying this, but at the moment, what's happening in EMRs is that we spit out these risk scores, right? Which are based on the data in the EMR. So if, like me, as a bad GP at one point, I would code as like telephone consult, because it was a telephone consult, because I didn't know about coding. I didn't know the need for coding or why we needed to code. So I would just, write my notes, no coding would go in. If you haven't coded the note, then you're not going to code those risk scores for like seeing if your patient needs a statin or something. And so I see the big thing here is improving that with scribes, because you've automatically got this. Now you've got the structured data that you need. So it's lots of possibilities. The other thing I was just going to very quickly say is about the processing is like we find that now in the product that there's the ambient listening. So when like the technology obviously listens, doesn't save any recording, but creates that transcript, the note, and the downstream documents, some clinicians prefer it to be in exactly their language. So we have a direct, it's less of a dictation because you don't have to say full stop next paragraph.
Sure.
But for certain examinations or things, people can kind of speak and say exactly what they want to, similar to what you were saying, so that they can process and say, oh, actually, thinking about this is the plan I want for the patient, et cetera, et cetera. So trying to merge those two of not just fully ambient. You've also got your own mechanisms to type or speak in as well.
Yeah. The other benefit as well that I've heard is I've heard the litigation one where they've had patient complaints and they've literally been able to just go back into either the recording or the transcript where they are being recorded and literally be like either yes, absolutely, we will proceed, or absolutely not, here's a snippet of the recording that didn't actually happen, I'm afraid, and it's protected the clinician. So I've heard both, and it's another just interesting angle, because again, where big health systems are involved, you start to multiply litigation costs, you start to multiply legal fees on retainer for a small business, I can tell you, is quite painful, let alone when you've got a magic circle firm for the NHS, like on retainer
Yeah,
or whatever they've
yeah,
got. Like,
exactly, exactly.
yes, I imagine
Yeah,
that racks up as well as quite an important value proposition.
do you know what? We had someone, I'm sure she won't mind me saying this, Lauren, who joined us recently as her background's in obstetrics and
Mm,
gynecology as a registrar. And one thing that really drew her to Tandem initially was that there was a big case at one of the trusts she worked in around, it was a maternity
yeah,
case, and the ward round that had been done, there were just kind of one line in the
yeah,
notes,
standard,
basically,
yeah,
on this ward round, because that's what everyone
yeah,
does, right? It's just there's no other time. And her thought was there was a litigation case in the trust. And she just said, I just know that if the scribe had been there, if the scribe had been on that ward round, things would have been very, very different, which doesn't make it, better for the outcome. Like, I think there's different things at play here, but I think there could be, when we talk about medical legal things,
mm,
even just having, accurate clinical notes with information in it is helpful from a care perspective for other people to see within the medical records.
mm.
So I think there's huge, huge potential here for acute trust as well.
It's interesting, isn't it? Because you and I both clinical backgrounds, that when you talk
Yeah.
about recording all of your interactions as a
Mm.
clinician, it starts to be like, oh, actually, sometimes they're super contextual based on, like, I'm not going to
Yeah.
ask all the stuff I should ask in inverted commas, so that if that was
Yeah.
to look blah blah blah, and this sort of, and everything changes when it's observed. Of course, it can add
Yeah.
cognitive load. It can, can take it away if you're writing notes. So
Yeah.
there's interesting stuff there. I
Yeah.
think it does. My sort of final question or
Mm.
bit of discussion here is about, with all of that together,
Mm.
we're in a position where we can reimagine the system. I think that's what AI is enabling us to do. And a
Yeah.
system where, Keith said this on stage at the Google event. He said that the worst thing that we could do is take the exact system that we have now and try and
Mm.
make everything quicker, better with AI. That is not the right
Yes.
way to do things.
Yeah.
It's the right way to do things initially, perhaps to build
Mm.
trust and to show what's possible. But actually, you point to a world where that ward round was recorded. A lot of other things transcribed. Let's say the scribe was there in some
Mm.
context.
Yeah.
It's a different system that's in,
Yeah.
because there's
Yeah.
probably not even a central note. There's probably not even consultations. There's probably just someone walking around talking to people. What leads to that is actually very
Yeah.
different. And so I don't know if you think about this, about where does this
Yes.
all go? What does this be
Yeah.
reimagined into? Are there hospitals even? What are they for? Is everything in
No.
the home? Is
Yeah.
like, because we're in a position where we don't have this leadership from anywhere going, this is the vision of perfect healthcare we're aiming towards. We need to stop doing
Yeah.
AI everywhere else and focus it on this, which is kind of my thing of like, why doesn't that exist? Like, we should be aiming towards something rather than deploying it everywhere and hoping for the best. So
Yeah.
I'm interested in your view.
This keeps coming up actually, because in big trusts, obviously there's often hardware issues, and people are like, are you just papering over the cracks with AI of like actually a technological system
Mm,
that just doesn't work? I think there's two main things to think about. One is that we can almost leapfrog some of these systems with AI at the moment to enhance current working conditions, um, which is exciting,
mm,
I think. But then, so I was talking earlier about the bigger vision of combining communication in healthcare with these administrative tools. And I think there's stages of transformation, right? There's like
yeah.
that we go through, but this will almost, I think in my mind, this kind of puts the kind of foundational layer down for what's to come next. And that's further transformation in healthcare with agentic AI and different ways of
Mm,
triaging, and then optimizing routes for patients. I still think we'll need clinicians. I still think we'll need hospitals. I just think that the system will run in a very different way to where we see it now. But I don't think it would be helpful to talk about that to people now, because that would totally freak them out. But what we can kind of see the path, and it's a step at a time to bring people along the journey with us to where we want to go. And this is the bit that excites me most, is I think to truly transform, you do have to start fitting in
mm.
to the workflow, but then you start to kind of move people along with the flow. And
I think once you gain the trust of people,
Yeah.
through whatever distribution mechanism you choose, if you start to gain the trust of people, you can start to enact your vision then.
Yeah.
And obviously, in partnership with them, you can understand their needs, their wants, their desires, and you can actually start to move with them, which I think is the most important thing. I think for people like you and I that have been in this game for a fair amount of time, I think this is the bit that we've been waiting for, right? This is the bit where it's like, oh, we're in the story we're going to tell later. Like now
Yes. Yeah.
we're finally in it. This is the we're sort of at the end of the pre-AI world, and we're about to enter the post-AI healthcare world, or at
Yeah.
least the intra or whatever it is.
Exactly.
Which is so exciting. And
Yeah.
I think if there's the one thing I'm going to take away from this is that the actual value of scribes to health systems is far beyond the benefits of the clinician in saving time. It's actually in the structured data and the insights that can come at population level if we're able to actually deploy them at that kind of scale within systems. So that is what I'm going to take away from this. So Katie, massive pleasure having you on, and thank you so much.
Thank
It's
you.
been an
It's been
absolute
very
delight.
fun.
If people want to learn more about what you do, or they want to get in touch with you, what's the best way for them to do so?
Yes. So I can send you some links to put on this channel, but we're kind of tandemhealth.ai online at the moment, but we can update kind of the description so there can be a link to me and to Tandem so people can have a look at what we're doing, or reach out to me separately if they have questions on anything we've spoken about today.
Amazing.
Always happy to chat to people.
Thank you so much.
Awesome. Thank you so much as well, and have a great rest of the day. Thank you.